Welcome to Deny Delay Depose. Health over wealth. Okay, so what a week, right? I mean, between the ongoing Mangione case and now this friendly fire incident in the Red Sea, it feels like the world is just spiraling.
Absolutely. It's like the chickens have come home to roost, you know? For too long, the system has been denying people what they deserve, delaying justice, and now, well, you see the result. And friendly fire? Please. That's a perfect symbol of the chaos the U.S. military is in.
Hold on. Spiraling? Chickens coming home to roost. I think you two are getting a bit carried away here. Yes, these are serious events, but we need to keep a level head. The military incident was clearly a mistake, a tragic one, yes, but mistakes happen in complex operations. And Mangione, let's not make him out to be some kind of hero. He's a criminal.
But is he, really? I mean, I understand that obviously violence is never the answer, but think about the circumstances. All the stuff that's come out about his background, about his family, his frustrations with the healthcare system, IT quote S. Not like this came out of nowhere. It's the result of a system that's designed to put profits before people.
Exactly. It's symbolic violence. They deny you care, they defend their right to deny you, and eventually it's going to provoke a response. It's basic Newton's third law of motion. And his family history, that's crucial. His father owning a nursing home, you know that's where a lot of these insurance practices really hit people hard. You see the vulnerabilities in our elderly, how easily they can be taken advantage of. It's a direct link.
Okay, but let's not conflate a nursing home owner's business practices with an insurance company CEO's practices and symbolic violence. I mean, we're talking about a planned assassination here, not some form of street protest. You're giving him way too much credit and, frankly, romanticizing it. You can't use violence as an excuse. There are plenty of people who have faced similar challenges and not turned to murder.
Of course there are, but that doesn't mean we should ignore the systemic factors. It's not about excusing his actions, it's about understanding why. We're constantly being told that the American dream is accessible to anyone, but when people are struggling to pay for basic health care, when they see their loved ones suffer due to insurance bureaucracy, it's no wonder they get desperate. The system is the problem. The fact that the healthcare system in the U.S. is so focused on profit, that's why we have so many issues.
Yes, and it's not just the profit, it's how they get the profit, the denial and delay tactics, the paperwork hurdles. It's all designed to break you down. They rely on the fact that people are already stressed and in a vulnerable position. The whole deny, defend, depose thing, it's a perfect encapsulation of their strategy. And it has become a kind of rallying cry, hasn't it? A symbol of resistance, however flawed.
But that's just how insurance works. They are asterisk businesses, not charities. They need to make money to pay for legitimate claims. If people could just demand whatever they wanted, the whole system would collapse. It's a risk management industry. And while there are inefficiencies, and I am not saying it is perfect, most of those denials are legitimate for some reason.
Yes, but that's precisely the problem. Healthcare should not be treated as a business. It's a basic human right. And this idea that they're just risk managers is a cop-out. When they actively look for ways to deny claims, when they put profits above patient care, it makes them more like gatekeepers than anything else. Think about how many people delay care because they are scared of the bill. Then they only go to the ER when they are sick enough, and it's way more costly and more of an impact on society.
And, it goes deeper than that. It's not just about individual insurance practices, it's the whole damn model. We're paying far more for healthcare than any other developed nation, and yet we're getting worse health outcomes. That article about the Navy pilots is a good example. You have an advanced military, supposedly, and yet we can't even prevent friendly fire. This is exactly the kind of bureaucratic mess that the healthcare system is in, and Mangione, he saw it, he understood it, and that's why he acted.
Okay, now you're jumping from one problem to another, just trying to make them fit your narrative. The military incident is a mistake, a horrible one, but mistakes happen in war. It's not a reflection of the entire military's competency any more than Mangione's case is a reflection of the whole healthcare system. The system is not perfect, but it does serve the majority of the people. A lot of people are actually quite satisfied with their health insurance.
Satisfied? Or have they just been conditioned to accept the bare minimum? How can you be satisfied when you see people struggling to pay for insulin? When you hear stories of people getting denied life-saving treatments or having to crowdfund to pay for their medical bills? There are people actually dying because they can't afford medical care. That's not a functioning system. And that friendly fire incident, it just underscores how systemic issues can be so pervasive. They can occur in any organization.
Exactly. It's not about a few bad apples. It's about the whole orchard being rotten. The Mangione case is a clear symptom of a system in collapse. People are desperate and feel unheard, which is why they are turning to what they see as radical measures. His actions, despite their violence, are a desperate cry for change that a significant portion of the public clearly understands.
Again, we're romanticizing violence, and I'm not comfortable with that. Just because some people support Mangione, it doesn't make his actions justifiable or a valid approach to change. You can be frustrated with the system but not break the law. There are processes in place to make change. It's called voting. You can donate to politicians that will change the system. There are many ways. Violent protest is not the way, and neither is murder.
But what happens when those avenues for change are blocked or ignored? When lobbyists and money influence the political process so much that our representatives become unresponsive to the needs of the people? That's when people feel they have no other option. In the media, they're just perpetuating this narrative, making it seem like it's all down to individual choices, or that he's just a madman. They're not looking at the bigger picture, the socioeconomic issues, the fact that this family is in Baltimore, a city with significant health disparity issues.
Yes, the media are part of the problem. They focus on sensationalizing the story rather than examining the root causes. They perpetuate this idea that Mangione is just a lone wolf when actually I see him as a reflection of a widespread discontent with the system. The Free Luigi movement, the merchandise, those are not just about him. They represent a wider feeling of frustration with the broken healthcare system.
Okay, but that's a very small minority making noise, just like those who defend the violent acts of those in the past. Most people recognize that violence is never okay, regardless of how frustrated they are. And these alternative healthcare models that you keep mentioning aren't some kind of magic bullet. They have their own issues too. They're often underfunded, lack the resources of the big private insurers. We need to be realistic about the limitations of those systems.
But aren't those limitations often imposed by the very system we are criticizing? The funding limitations, the lack of resources, they're not inherently flawed, they're deliberately undermined to maintain the status quo. And I'm not saying alternative models are a magic bullet, but they do represent a different approach, a focus on patient care rather than profit. Imagine if we could actually optimize the healthcare system for patient well-being rather than maximizing profit margins. I think we would see a very different outcome.
Yes, and that's why I see Mangione's case as a potential turning point. It has forced people to confront the deep-seated issues that our system ignores. I'm starting to hear people talk about universal healthcare more, about single-payer systems, and that's thanks in large part to this case. He's a martyr, not a villain, and if they kill him, he will only become a greater legend. It's like the military incident as well. The fact that a supposedly friendly fire can happen shows how our system is flawed even in places we consider strong.
A martyr? Come on now, let's get real. He committed murder, he ended someone's life, regardless of what his motivations were. You can have criticisms, but you don't have to take a life. And to use the military incident as more evidence of systematic collapse is really over the top. This was a mistake. There isn't a perfect system anywhere. Humans are not perfect and mistakes happen. It seems like you're seeing connections where there aren't any. It's not the system conspiring against you, it is just how things work.
Exactly. It's a pattern of ignoring the warning signs, of prioritizing bureaucracy over people's lives. And that German attack, it's another example of the system failing people. It's the same with the military shooting at their own jet. All of those systems, they're so bloated and complex that they become their own worst enemies. That's exactly what's happened to the U.S. healthcare system. And Mangione, I think, saw that collapse coming and tried to give it a push, a radical push. He saw the symbolic violence perpetrated against him and others, and he returned that violence.
You're really twisting things to fit your narrative here. I mean, are you saying that the German authorities are part of the same system as the US healthcare system? You're drawing these very tenuous links. These are separate events, separate issues. There will always be bad actors, and there will always be mistakes. It's part of being human. That German doctor had issues, and the system failed to recognize those issues. And that's sad. It doesn't need any more connection than that.
But it's not just about one bad actor. It's about how the systems react to these bad actors. The German authorities received tip-offs but didn't act or reacted too late. The same with our healthcare system. There are constant complaints about the way people are treated, and yet no significant changes happen. This is why people are so frustrated. There's a feeling of powerlessness. No one is listening to these issues, and no matter how much people scream, there's no action. I am not advocating for violence. I am trying to show you why people like Mangione felt like they had no other choice. And that feeling of hopelessness is not going away, it's growing. We need to address these systemic issues, or things are just going to get worse. We need to optimize for people rather than for profit. And there's nothing wrong with asking for the system to treat human beings as human beings instead of just numbers on a spreadsheet.
Yes, and if we don't learn from these events, from Mangione's case, from the military incident, from the Christmas market attack, then we're doomed to repeat them. The system will continue to fail, and desperate people will continue to resort to desperate measures. And it's not about excusing violence, but about understanding the conditions that breed it. We need to really look at these alternative models that people are starting to create to find what works, instead of blindly defending a clearly broken system. That's the only real way to prevent the next Mangione.
But to say that it's the only asterisk way is really going too far. There are steps that can be taken within the current system. We need incremental change. Radical overnight solutions, they don't work. And let's not forget that many countries with universal healthcare still have problems. There are issues with waiting lists and access to specialized care. There's no magic bullet. And it sounds to me like both of you are trying to create this false equivalency to justify an outrageous act.
I think we all agree that the current system needs change. I just think that we need to explore options outside the current model as well. It's not about saying everything in this system is bad or every part of other systems is good. But we need to start asking questions and examining what options are available for actual people instead of just the profits of those running the system. We just need to move beyond blaming individuals and start looking at the larger systemic issues. We are stuck in a system that creates frustration and leads to desperate acts.
Absolutely. The current system isn't just flawed, it's fundamentally broken, and we need to consider all options, even radical ones. We can't be afraid of change. If the system doesn't address the systemic issues, then events like Mangione are going to happen again. It's not about glorifying the violence, but acknowledging the systemic failures that made them happen. That's the real lesson from these events, and the military incident should be a similar warning. These are not isolated problems, they are symptoms of much bigger issues.
Okay, I agree that there are certainly things that can be improved, and I'm all for a better system, a more efficient system that provides quality care for all. But I don't think radical change is always the answer, and I certainly don't think we should be lionizing someone who committed murder. I think it's also important to remember that in a free market system, healthcare and health insurance will always be expensive. There are also factors outside of the U.S. health system that affect health. Diet, smoking, and exercise also play a major role. All of these factors need to be taken into consideration, and not all of those factors have to do with the system.
Right, and that's a good point. Personal responsibility is definitely a factor. But it's hard to make healthy choices when the food that's readily available is cheap and unhealthy, or when people are working multiple jobs just to survive, or when they can't afford to see a doctor for preventative care and things get out of hand. It's hard to fix an individual when the environment around them is unhealthy. It's a web of interconnected factors, and our current healthcare system isn't helping those individuals.
Exactly. It's not just about individual choices, but the system actively reinforces unhealthy behaviors. And when people struggle with those consequences, they can't afford help because of the system we are talking about. So it's really a self-perpetuating cycle of poverty and disease. The media focuses on the sensational aspects of it all, and it's really designed to distract us from these systemic flaws. That's why these events, from Mangione to the friendly fire, to the German attack, they all feel connected to me. Because they are all symptoms of the same underlying disease, a broken system.
Okay, I hear you. I do agree that we need to address socioeconomic issues as part of improving the health system, and that the media could do a better job of focusing on the larger issues. But I'm still not convinced that any of these things are fundamentally connected. These events, despite being tragic, are also relatively rare. They don't reflect the overall functioning of the systems involved. There are thousands of successful flights every day. There are millions of satisfied health insurance consumers. And there are millions of people safely going to Christmas markets every year. We can't let the outliers dominate the narrative. We need to see the big picture.
Right, and I think that's a point we can all agree on. The system has flaws that need to be addressed, and we need to start looking at options, including alternative models, to make sure that our focus is on human well-being and not profits. I hope that the discussion we had today is able to help some people look at this from a different perspective.